Hello, everyone, and a very warm welcome to the webinar, Feminist Approaches to Global Health Policy, Perspective Pathways and Germany's Role. So this webinar is hosted by the Feminist Policy Subgroup of the Global Women's Health Community of the Global Health Hub Germany. My name is Hanna Eger, and I lead this Feminist Policy Working Group, and I'm also affiliated with Medicine du Monde Germany and the Charité, which is also based here in Berlin in Germany. And for those of you who are not familiar with the Global Health Hub Germany, it is a network that unites global health actors from across 8 stakeholder groups here in Germany, and the Global Women's Health Community is one of 12 thematic communities of the hub. And also, if you want to learn more about the hub, we'll also post a link to the chat. So on behalf of this community and the Feminist Policy Working Group, I welcome you, and I'm very delighted to see that this webinar attracts so many people and that you're all interested in learning more about feminist global health policy. Before we start, I also have some very short information on housekeeping. So I've already mentioned that the first part is going to be recorded and also published by the Hub, but we will not record the Q&A session. Of course, you're very welcome to turn on your video, but I just want to ask you to please remain muted until the Q&A, and then you'll have the opportunity to engage with the panel. But if you want, you can already write your questions down in the chat during the inputs, and we will then address them later. And you also have the option to use the virtual hand symbol during Q&A to directly ask your questions. So that's it about the formalities. For the next approximately 1 hour, we will listen to 4 key insights by our very esteemed panelists, who are Dr. Kuhlmann, Dr. Shirin Heidari, Dr. Lisa Hoffmann, and Elizabeth Kayanga, who I will also properly introduce when they give their inputs. And these 4 insights will then be followed by a panel discussion among the panelists, and then we'll have time to take some questions from the audience. And as you can see, this is quite a tight schedule, so I suggest we get started right away. And we will begin with Dr. Ellen Kuhlmann. Ellen is a senior researcher at the Institute of Economics, Labor and Culture at the Goethe University Frankfurt in Germany, and she will provide an overview of how gender-based discrimination is affecting healthcare and the health of everyone, and hence highlighting the need for different approaches in health policy. So over to you, Ellen.
Thank you so much for this invitation, and especially let me first say that I'm really very, very grateful that you are organizing that, and that you are organizing it as a feminist webinar and not just as a gender equality webinar. So why do I think it's so important to stand up and talk about feminism again, to reclaim women's health from an intersectional perspective, of course, but also feminist approaches are not only about women's health, they are also against all forms of anti-democratic attacks. They are for human rights more generally. So, and I think in these times, in this climate, where new rights, where populist approaches, where violent attacks, verbally and physically, against women, against all that are labeled others, are gaining ground again in Germany as well as in Europe. So in these times, it has perhaps never been more important than now to remind ourselves and others how important it is to talk about feminism. And I think, and that is my last comment before I give you some more examples, I think we have had, and I'm saying we, as you see from the older generation, where we were talking about the women's health movement, starting with that. We have really great achievements. We should never underestimate that. We have really achieved very important steps towards gender equality on the legal level. So we have great improvements in women's health, in maternity health care in Germany. But I think also in several, not in all, countries across the globe. So, but having said this, I think it is also important to understand that it is not enough to talk about gender and diversity, and that we perhaps have been too long, too patient, because we were assuming that it sounds nicer to talk about gender, that it provokes less resistance to talk about gender than talking about feminism. And I think the last few months, and especially the COVID-19 pandemic and recent developments and these right-wing movements have shown us and taught us that it's time to stand up again. So having said that, I promise to be very brief, and I would like to use a few examples from a comparative health policy paper that I did during COVID-19, and where we used COVID-19 as an example to look how has these crises impacted women's health, and how have been the responses, the policy responses. The paper is available, so I really only highlight a very few key messages. And I want to mention that we, unusually for global health, started with looking at the bright side. So we looked at high-income countries with also higher middle-income countries, but we really looked at the bright sides. We have selected healthcare systems that had well-established public health and well-established healthcare system, but also equal opportunities. So we looked at Germany, the US, the UK, Brazil, and Australia. And I must say that that the time we did this study was Brazil under the Bolsonaro government. That's perhaps important. So, and we were thinking, we are looking, what is crisis? What is a crisis doing to women's health? When we are looking at the bright side, when we are looking at optimal conditions where we had achieved a lot of gender equality rights and improvements. So, we used the SDG 5, the Sustainable Development Goals of the United Nations, and 5 stands for gender equality, and had selected 3 key issues. So that were maternity care, on sexual and reproductive rights, gender-based violence, and then we looked more generally at gender equality and women's leadership. And it shows that in all countries, that none of the countries was really able and willing to protect gender equality, to protect women's health. So beginning with maternity care and reproductive rights, we found, again, across all our countries that had different healthcare systems, we found that all countries did comparably well with protecting the basic biomedical services for maternity care. That is important, and that has not been the case in many countries of the world. But in our countries it was, but they failed in all other areas that is more on social, on counseling, on these kind of services that have been especially important and that have been highlighted by women very often who are working in that area, how important that is, not just biomedical. So we found a turn totally strengthening again core biomedical approaches and neglecting everything else. And then with reproductive rights, it was even more important because we really found that these cuts in all these counseling, support services, information prevention services that really strongly affected women's health and strongly reduced the opportunities for women to exercise their reproductive rights. And the strongest example of that is abortion rights, where we found, and I come back to that in a minute, we found different developments. So we found that example you are supposedly all aware of. We found the new restrictions unexpectedly in the United States at that time, unexpectedly, whereas in where is a big debate that abortion is again illegal. But we also found some interesting examples in Australia and the UK or England, more specifically, where there were small improvements, so that for the first time, for instance, it was possible to get this pill after without showing up to get the prescription just online or via a telephone call and these kind of things. So it also shows there were also some opportunities, and under certain conditions, if there were strong actors in favor of this, it was possible. We do not know whether these improvements are sustainable, I must say, because we would need new studies to see how that turns on. So, and then to sexual violence, that is one of the worst areas, and I think you will all know that, I guess, that sexual violence has strongly increased during COVID-19 in all countries. In all countries, and in our countries that had strong legal protection of women. So you all know that. And there were no really, it was very, very long silence. There was not a big outcry from policy. There were no really sustainable actions to protect women. And I think that is one of the most important lesson that we also learned. Again, in this area, we found small differences, and again, in the UK and in Australia, there were some minor improvements, and also in Germany, we had some minor steps so that we improved, that it is improved that there were online services and these kind of things, but this was very, very minor and not able really to respond to that. And then my last point is the leadership of women. And that was really the other very strong lesson we should learn, that during a crisis, women and women's health and gender equality, and I'm always having this intersectional perspective, but I'm not always saying that. So these were always the first that were forgotten. We had, if you sometimes, even if you saw the pictures, you saw men, the women, even in let's say Germany as an example, we have clearly defined equal opportunity guidelines. In these newly established COVID-19 pandemic bodies, there were often no equal opportunities officers. They were very often excluded. So these are my three examples very briefly, and what to learn from that. I already mentioned that. Firstly, so was that there is no country was really able or willing to do a proper job and protect women and protect gender equality laws, their own gender equality laws. And that means there is a strong need for better monitoring of health policy through a feminist lens. That there is a strong need for women leadership in all decision-making bodies, nationally and internationally. And that means when women, from an intersectional perspective, we also must take into account minority groups, sexual minority groups. So this is one key lesson that we had to learn, and also that we had to understand, and that is second important lesson, that we have to understand that attacks against women and women's health rights in one country never stand alone. So that means we should also start nationally and have this global approach, because we can assume if we take steps nationally and if we try to make these connections, that is also a way to improve global health, and that we must be very clear that global health and that crises hit impact on women's health, and they impact most strongly and most severely on minority groups, and much, much more strongly than in our countries in the global south. So
Your last point, please, Ellen,
having
regarding
said
time.
this,
Yeah.
I wanted to say thank you very much.
Okay, great. Thank you very much, Ellen, for presenting us the status quo and also for sharing your research with us. I think it has been really helpful to setting the scene, also to show the progress, but also the many challenges that still lie ahead. And so the next input will be given by Dr. Shirin Heidari, who's the founder and executive director of Gendro, and she's also a senior researcher at the Gender Center of the Geneva Graduate Institute. And Shirin will briefly guide us through intersectional feminist and decolonial approaches, highlighting the components she believes are essential for any feminist global health policy. And she will also share lessons learned from feminist foreign policy and how these can then inform more equitable global health strategies. So over to you, Shirin.
Thank you so much, Hannah. And this is a hard task to follow Ellen's footsteps and also do all of those things that Hannah said in 5 minutes. So I will do my best. Again, thank you so much for organizing this meeting and for the opportunity to join this conversation on this important topic that is very close to my heart. This is particularly a relevant topic given that our world is facing multitude of health crises ranging from the shadows of the global pandemic to various outbreaks to the devastating impact of conflicts and war and climate disaster and the increasing anxiety over how the rapid pace of the technological advancement will affect our health and health system, while at the same time we're also dealing with the aging population and growing health expenditure and financial challenges to making health system meet the needs. So these challenges all contribute to widening health gaps and disparities in health outcomes that often women and girls carry the disproportionate burden of, as well as marginalized populations. And clearly, we urgently need to find and apply an equitable and gender responsive approach to global health, from research and data analysis to policy and service delivery. Now, when I'm asked why feminism in global health, I like to remind people that despite the fact that it's 30 years after the landmark Beijing Declaration and the Platform of Action, and despite the many progress, our world still operates largely under a patriarchal order. There is even a resurgence, as Ellen also mentioned, of patriarchal values as seen in the recent backlashes against women's rights, threat against women's health and bodily autonomy, the growing anti-gender movements, even in places like Sweden. I'm from Sweden and I've always been so proud for Sweden being a pioneer and the feminist foreign policy, and seeing a rollback, they really retracted their feminist foreign policy, demonstrating how fragile and fleeting the nature of these commitments are. And again, Ellen also mentioned that we have seen a lot of progress. There is an increasing recognition of gender biases in research, in health research and medical research. There is an acknowledgement of the persistent gender pay gaps in health workforce and the health sector. There is a growing attention and growing number of initiatives focusing on women's health. Despite all of these, the progress is actually quite slow and very fragmented, with attention to certain areas but not to the others. And the specific and diverse needs and experiences of women and girls and other marginalized populations are often overlooked and often treated as an afterthought. And that is because the global health ecosystem, from research to policy making, decision making about healthcare delivery, still also largely operates under patriarchal dynamics. We are all influenced by the broader social and political dynamics in our world. And that affects, of course, the way that women and girls and people of marginalized population remain underrepresented in health research. They continue to face disproportionate health burdens and encounter barriers to gender responsive, equitable, and effective health policies and programs that leave no one behind, the SDG mantra. And that is why we need a feminist framework in global health, because the antidote to patriarchy is not gender mainstreaming, it is feminism. Uh, Global health issues are not only medical issues, they are political issues, and a feminist approach and a framework in global health would challenge us to look beyond the symptoms and address the root causes of health inequities and gender inequalities in health. Feminism at heart is about dismantling power hierarchies. It recognizes the complex interplay of power dynamics that shapes people's different experiences, opportunities. It acknowledges the overlapping systems of oppression that lead to unjust marginalization. And as such, feminism is inherently decolonial, anti-racist, and values the diverse voices and experiences of women and girls and other marginalized groups, aiming to create a more equitable and just and inclusive world, including for men. So adopting a feminist approach to global health is about not only integrating an ideology, but really to instigating real change. It's about activism. It's about viewing health as a fundamental human right and not just a privilege. It's about calling out the inequalities and actively working collectively, collaboratively towards restricting systems that perpetuate them. And it also means that ensuring that health research captures the diversity and complexity of health needs and the perspective of different populations, and ensuring that the evidence-based health policy making and health programming and health system really respect and value the diverse needs and voices of women and marginalized people, and allowing and ensuring that they are involved in making decisions that shape all of those aspects. Finally, and that's going to be my last slide, is that as we champion for a feminist approach, we also really need to reflect on the shortcomings of past policies in other arenas, like the feminist foreign policy. And despite the best intentions and despite the progressive rhetorics, many governments who have adopted feminist foreign policies or feminist development policies still often engage in contradictory practices, such as arms trades that kind of fuels conflicts and wars, enforcing restrictive migration policies, falling short of environmental commitments, providing insufficient support to grassroots feminist movement, and still struggling even domestically with gender pay gaps and gender-based violence, both domestically as well as in the public sphere, and really falling short of their true feminist values. So these discrepancies gives us a lesson and highlights the crucial point that as we are developing and creating a feminist approach and a framework to global health, our commitment to feminism must be really truly authentic and evident through our action. We really need to ensure that these policies truly reflect feminist values and principles of gender equality, social justice, diversity, inclusivity, really aiming to dismantle the entrenched gender, racial, and other power structures that perpetuate inequalities and health disparities. And I will stop there and welcome other speakers to join.
Thank you so much, Shirin, for helping us to understand the concepts and the components that shape feminist policies, and also to understand feminism as an antidote to patriarchy, and that it's about change and activism, and really to see the role power has, and especially power asymmetries. Really helpful. Thank you. So with that, we will now turn to Dr. Lisa Hoffmann, who is a Senior Policy Officer at the German Federal Ministry for Economic Cooperation and Development, and she works in the division Global Health Policy and Financing. Lisa will share insights on Germany's feminist development policy that has been adopted by the ministry in 2023, and she will focus in particular on its application to the global health work of the ministry. Thank you, and over to you, Lisa.
Yes, Hannah and colleagues, thank you so much for the invitation. And thank you also for the other great panelists that already set the scene so well that I will now just add from our perspective what we are working on now. It's really a pleasure for me to be here. So maybe let me say that for our ministry, actually even two priorities. 2 out of 4 priorities are related to the topics of today's talk. And one is, of course, the feminist development policy, and then 2, global health and bodily autonomy, which is another priority of BMZ. And of course, they also refer to several SDGs. Let me just name SDG 3, good health and well-being, and then also, of course, SDG 5, gender equality. And then maybe also to shortly mention that in my division on global health policy and financing, we are at the moment 100% female when we talk about feminism, which is coincidence, but still so many women actually working on these topics. So maybe let me shortly first start with the feminist development policy. And we actually explicitly talk about feminist development policy, a term which is perceived by many as a bit provocative, even though I think this is actually even more important because it helps putting the topic on the agenda. So feminist development policy is now more necessary than ever. It has already been mentioned before, for example, because of global crises, but also anti-gender movements all around the world. And in our feminist development policy, there are actually 5 key elements that I shortly point out. So 1, it is founded on human rights and the principles of non-discrimination, equal opportunities and participation, empowerment, transparency, and accountability. 2, we want to focus on a gender transformative approach. So, I mean, those of you who are familiar with the terms, actually there's gender sensitive, gender responsive, and gender transformative. And with a gender transformative approach, we explicitly want to focus on eliminating discriminatory structures. So this is actually the aim of it. Then 3, we want to look at inequalities not in isolation, but we want to consider the intersectionality of discrimination. 4, we want to follow a post-colonial and anti-racist approach. And then 5, we of course aim at seeking alliances within the international community and civil society organizations. Of course, as you can imagine, many key elements and goals. What does it mean concretely? So just to give you 2 examples. So one is we want to strengthen the so-called 3 Rs, rights, representation, and resources. And then 2, we think of a feminist approach as actually across the whole portfolio, so across different sectors that we are engaged in. So having said that, I now want to come to the topic of women's health more particularly. So first of all, I think many people think of sexual and reproductive health and rights when they think of women's health. And yes, I agree, it's definitely super important. But what is also important to us is that, of course, women's health goes beyond sexual and reproductive health and rights. I think a recent report has even shown that women spend on average 25% of their lifetime in bad health as compared to men, which is a huge percentage, of course. And there are different diseases that affect women exclusively, like the ones focusing on sexual and reproductive health and rights, for example, but then also diseases affecting women disproportionately or differently as compared to men. And I think this differentiation can sometimes be useful. So there are inequalities in women's health when it comes to, for example, research. So we also already talked about that. There is a big data gap, but also treatment, delivery, and then of course also investment when it comes to women's health. So there's still a lot of underinvestment as compared to male-specific diseases, for example. But at the same time, women and girls in all their diversity are actually most affected by weak health and social protection systems and health systems. And on the other hand, they are the ones contributing significantly to these systems. So for example, as health professionals, but also through care work. So now what do we do? So first of all, we have a core strategy on health, social protection, and population dynamics. And there we are also committed to concrete goals in terms of women's health. So such as strengthening rights-based sexual and reproductive health for girls, women, and young people, but also others, and strengthening health systems. Then through our bilateral portfolio, we are committed to strengthening health systems in over 20 countries. And in 12 of our partner countries, we actually have health as a core topic. And over half of them are active in the topic of population dynamics and sexual and reproductive health and rights. So out of those who engage in health, actually many countries also like to engage in women's health issues. What that means is, for example, we try to support partner countries in designing health systems in a way that tailored health services are offered to women and girls, and gender-specific barriers are eliminated. Then we are also committed to reducing inequalities in access and care, for example, when it comes to social security in the event of illness. And we promote bodily autonomy in our partner countries in improving access to health services, for example, also in the field of sexual and reproductive health and rights. In Malawi, there are some projects on that, just to give you an example. Then besides our bilateral portfolio, we are actually, when it comes to global health, we are very much engaged in international negotiations and multilateral instruments as well. So what we also do is that in international negotiations, we try to promote good gender language, because of course it's important what is in resolutions and how the topic of gender and health is addressed, which is difficult and becomes increasingly difficult if you look at current resolutions on health, for example, but also, for example, in the G7, G20 context. Then we support global health initiatives that are focusing on women's health and SRHR, such as GFF, UNFPA, and the International Planned Parenthood Federation. But also, besides those that explicitly focus on women's health, we also promote human rights and gender transformative approaches in other global health initiatives. So, for example, if I think about the Global Fund, then of course we try to make sure that HIV medication reaches the most marginalized and vulnerable people, such as sex workers and the LGBTQI+ community. So I hope that was useful to point a bit out on what we are doing. And with that, over to you, Hannah. Thank you.
Great. Thank you so much, Lisa, for presenting what is already happening in Germany and also the systematic approach the ministry actually takes, and how this work can also and does also inform a feminist global health policy. So with that, we will now turn to our last but definitely not least speaker, Elizabeth Kayanga, who will now shift from theory to practice and present us what these rather theoretical considerations actually mean on the ground. So Elizabeth Kayanga is the executive director of IDIWA, which is short for Integrated Disabled Women Activities, a women-led indigenous organization based in eastern Uganda that is committed to challenge the patriarchy and disability-based marginalization. And she will share how feminist principles are reflective in IDIWA's work, outline the challenges that arise, and also explain what is needed to ensure that health for all becomes a reality. Over to you, Elizabeth. And you're still muted. You need to unmute yourself.
Yeah, you hear me?
Yeah, now we hear you. Thank you.
Thank you so much, Hannah. I'm grateful for the opportunity provided to participate in this webinar and also be able to share and present what feminist considerations mean for our work. I'm Elizabeth once again, and I would like to share some of the principles that guide our work. First is challenging the organizational behavior. We look at our own organization and we challenge any disability-based discrimination, any social norms, oppressive ideology, being mindful that this should start with ourselves. It is important that we look at our organizations, we examine the conscious and unconscious bias, and look at how these play into correcting inequalities that exist in our societies. In our organization, our staff are encouraged to speak up or speak to their managers in case they are not able to address issues of sexism or sexual abuse directly. And we also include these principles in our performance management frameworks, which highlight the feminist leadership model, emphasizing feminist values and behaviors for us to bring to our work. Can we proceed? the presentation. Yeah, about power sharing, we challenge the organizational culture, starting with our own organizations and other organizations, and the social norms that contribute to power imbalances experienced by women and girls with disabilities. We go by the slogan, nothing for us without us. And this means that we need to empower the most vulnerable women and girls with disabilities to take up positions in decision-making platforms and speak against injustices and issues of inclusion. We ensure representation in governance in our own organization. There is involvement of women and girls with disabilities in all our advocacy processes. We are very conscious about power, and we try as much as possible to avoid dominating others during discussions. Our organization embodies equality and diversity. We are committed to fairness, equality, equity, diversity, and inclusivity among in the workplace. And we ensure to live by this, and our equality and inclusion policy demonstrates these organizational values. We also take into account how others feel endure. We are also mindful that feminism is for everyone. It's not about women. And we realize there is a lot of unfairness in terms of gender roles and stereotypes, and these negatively impact all of us in community. And all efforts must ensure that this is dismantled. We are working to ensure that patriarchy is dismantled. We are mindful that feminism is not about one gender coming out or on top, or it's about equality. Our staff are encouraged to be proud feminists, both men and women. We practice feminism principles in our day-to-day work, at home, and in social spaces. And we put women issues to the front and center. We take urgent action on sexual assault, domestic violence, sexism in the workplace, unpaid care work. We advocate against laws that limit women's control over their bodies. And we also address outdated masculinity that limit men's interests, self-expression, and access to emotional support. We realized men are keeping quiet about issues of domestic violence. And if we are looking about holistic development, yeah, we need to address issues of all gender. Yes, continue. We are also working on feminist movement building. We acknowledge that being part of the feminist ecosystem ensures that our actions and policies do not undermine or duplicate other feminist acts or other organizations' work. We work in harmony. We recognize the responsibility to promote gender equality and advance progress on ending sexual and gender-based violence against women and girls with disabilities in partnership with all feminist activists and women rights organizations. We deploy a movement-building approach. We have invited feminist activists and women rights organizations to a new sub-regional formation, that is Busoga GBV and Disability Rights Network, and we are increasingly witnessing women's rights organizations mainstreaming disability in their programming. Accessibility to sexual reproductive health rights services and rights. Accessibility to these services and information is often challenged by inaccessible built environment, lack of sign language interpretation for women and girls with disabilities. But we also realize that access is opposed by intricate invisible networks that include the interconnected punitive policies and restrictive laws, social norms, stigma, discrimination, And these directly or indirectly deter women from fully accessing sexual reproductive health services and realizing their full rights. IDWA has influenced local SRH legislation, which addresses local priorities and actualizes implementation of international and national legal frameworks at the lowest level. So what implementation of the feminist principles, what challenges and what needs to be done to ensure health for all, including women and girls and people of all genders everywhere. So what challenges are we seeing? We realize that the development sector is a product of colonialism, but we also urge everybody that all our efforts should seek to dismantle in unequal power relations that exist everywhere. Legislative frameworks and policies are embedded in a patriarchal system, and this creates perceived acceptable imbalance and inequality in our societies. And due to illiteracy, poverty, and inaccessibility, health services, women and girls with disabilities still die in the hands of traditional birth attendants. They are unable to seek professional services. And we also realize that experiences of LGBTI women and sex workers are dependent on prevailing societal attitudes that are informed by interlocking religious, political, and cultural beliefs and practices, and these heighten sexual repression and evoke intersecting stigma for the LGBT community. What needs to be done? There is
your last points, please, Elizabeth.
Yes.
Great.
There is need for universal design of the health infrastructure, including physical access and communication. The culture should champion commitment to gender equality and human rights. And we should also focus on catalytic, transformative, systematic that addresses the root barriers that prevent access to sexual reproductive health services. And we need to sustain the grassroots women with disabilities, human rights defenders, because they are the first responders to SGBV. And there's need to invest in feminism, feminist women-led initiatives to improve SRH knowledge, sharing and learning, networking, data collection, and providing evidence-based research and publication of SRH information. Thank you.
Thank you very much, Elizabeth, for presenting your work and also for filling these more theoretical concepts with life, and also for highlighting that it's not only about the external impacts, but also that organizations really must look internally first, and that feminism is also about mindfulness and harmony. And thank you again to all the panelists for being so concise and brief with your very insightful inputs. So really much to think about and reflect. And I would have loved to listen to you for longer. But now we want to try to bring it all a bit together and also discuss the implications for Germany. And just as a reminder for the participants, I hope we will have time to address at least some questions from you later. So if you have any, please already post them in the chat, or you can also later ask them directly. So far, we have already heard about the potential benefits of a feminist global health policy in general, but also for Germany. And we also have touched on many of the challenges, so especially also in particular when we look at the current crisis and the uncertainties and the conflicts and the situation of the world, basically, but also challenges related to really truly implementing feminist policies, especially that often the practice is not aligning with the intention or the theory, as also Shirin mentioned. And I hope we have time to touch on these challenges later and maybe also how to avoid them. But now I would like to have a very short round from the panelists to think about what role can and should Germany play for feminist global health policy, and maybe also what role shouldn't it play, because we heard a lot about the decolonial perspective and colonial continuities. So I want to ask a quick round of thought on this from every panelist. And maybe we start with you, Lisa, if you don't mind.
No, of course, I can quickly start. I mean, in my opinion, Germany should put gender equality as a priority and also women's health as a priority. And I think there are some concrete things that basically could be done. So, I mean, of course, in a time of crises, but also constrained resources, we need to build good alliances with like-minded partners. So we need to be strong in this. I think it's getting more and more important to learn from what works good, but also from what has not worked in order to maybe avoid the same mistakes that were made, but learn from what works in some contexts and then think about how to actually apply it in other. And I think we maybe the last point I want to make is that it's important for us that the demand for such projects, for example, is also there, right? Because we talked about decolonial approaches, and this means for our work that, of course, we do not try to kind of pressure countries to do projects in one specific direction, but we actually want to be demand driven. So we want to do projects that are also desired by our partner countries. And I think this is very important that, yeah, the demand is also there because we really want to work together on one level.
Yeah, great. Thank you. Shirin, maybe you want to add to this or add any new points?
Sure. No, thank you so much. And thank you, Lisa. It's great to hear more about all the investment and the support that is going on in this area of work. And I agree. I think it's great that there is a intentionality of making this demand driven and allowing really the feminist movement to decide what they need investment for. And I think that goes back as well to the broader discussions around if we are really serious around bringing feminism in global health, it really needs to also come with a sufficient amount of investment and funding, because what we don't want in our new feminist global health area is that all the gender work and the feminist work becomes yet another institutional unpaid care work that is shouldered by women in global health. And I think that is really a risk that is happening because the investment on gender and work health and women's health, while it's increasing in certain areas, it's still really not evenly distributed across all the areas. And certainly feminist grassroots organizations are not benefiting to the same extent. So I think my plea would be that there is also an increase in investment to really recognizing the value of this work, which is an important and expert work that people are doing. So again, thank you so much, Elizabeth, for also sharing your insights. And one last one before I stop as well is that when we're talking about feminism, I also really want us to also kind of embrace those in our own institutions in the global north as well. It's not only a theoretical thing that we say and we support others in the global south countries to implement. We really need to reflect on that within the global north organization, academia, political institution, NGOs, multilateral organizations, and I think that is really a serious concern I have, that in terms of our decolonialism approach, we really need to also be self-reflective and self-critical. I'll stop there.
Thank you. Yeah, Ellen, your answer to the question, maybe?
Yeah, I would like to echo what has been said and also Elizabeth's example. Start with your own organization, with your own country, and don't start with telling other countries what they should do. So that's all for the moment. I think that would be really helpful.
Great, thank you. And Elizabeth, you can go.
Yeah, thank you so much, Hannah. And I also want to add that there is need to promote women leadership and participation in decision making. We need to be at the table. If things are not working, women should be able to dismantle the table and start afresh. Yeah, then there is need to take into account the most vulnerable, the minorities. Yeah, they need to be considered. And there is also need to invest in women, in the women movement. Thank you.
Yeah, thank you very much. So some keywords are like truly true inclusion, definitely include the people on the ground and make them make the decision makers and building alliances and not imposing yourself on others, and definitely also investment and funding, because in the capitalist world this is the only way to go right now. So I would suggest we stop the recording now so that we also can include the audience.